to protect the most vulnerable is hitting another gear. Today, Kentucky's governor and health commissioner recommended select groups get a third dose of the vaccine and do it quickly. This comes just days after the FDA authorized Pfizer and Moderna's doses for this very purpose. WHS 1119's Isaiah Kim Martinez shows us the effort here at home and how some are already getting that third shot. He is live tonight with the story. Isaiah?
Well, Doug, it's another step in the mission for protection as doctors try to spread the word. Now, Norton Healthcare says at least a couple of their cancer patients got the third shot as recently as today, and one Hurst-born woman not wasting any time either.
It's a routine for fun.
Biking for sure in the evening after the sun's gone down.
While also being a conscious choice Jenna Parrott makes, not just to stay healthy, but to feel like herself.
You have a lot of symptoms that come on at once. It can be debilitating, but then those symptoms can go away. You never know when they're going to come back.
Now she's made another one.
For the booster, there'd been chatter about it for a while, so I knew it was going to be coming.
Thousands of immunocompromised people, like cancer patients and transplant recipients, have the okay to get a booster shot against COVID. On Tuesday, Kentucky leaders pushing for them to do just that.
Every resident of a long-term care facility to be eligible under this criteria.
Louisville doctors just as urgent.
And that just gives us more protection.
Saying it's another dose of the same vaccine aimed at boosting immunity.
As we got further out, their ability to have enough antibodies circulating diminished enough. And when they got this third booster, they have a 5 to 11 fold increase in neutralizing antibodies.
For Parrott, her qualification is multiple sclerosis, or MS.
You plan a vacation and you're like, you have no idea if sometime before then you're suddenly not going to have feeling in your legs or you're going to lose vision in an eye.
Diagnosed in 2018, Parrott faces the realities of nerve damage and a weakened defense where COVID-19 bears its biggest threat.
The medication that I'm specifically on is a B-cell depleting agent, so I have no B cells, and that's a key component to your immune system.
She explained why getting shot 3 was as quick a decision for her as it was for 1 and 2.
You know, there's nothing different to it. It's just giving your body some extra oomph.
While calling for others in a similar boat to do the same.
And health officials like Dr. Flynn say this process is not any more complicated than getting the first 2 doses. But for those wanting Johnson & Johnson's booster shot, they'll have to wait for now. Researchers are still looking into data on that. Doug?
Well, Isaiah, did Norton mention any plans for others, like their own workers, to get this booster shot pretty soon?
Yeah, Doug. Well, Dr. Flynn at Norton says they're ready with supply when given the green light. This is especially important because many doctors and nurses are reaching that 8-month mark since second dose. Now, that's the timing health experts are expected to use as criteria. Doug.